Imagine a scientific experiment causing an unexpected explosion so powerful, it shattered windows in a 5-block radius. This is not the opening of a sci-fi novel, but a real account from the annals of scientific history. Back in 1848, a group of chemists embarked on an ambitious project to synthesize a new compound. Their hopes were high, their calculations precise, their dedication unwavering. Little did they know, their experiment would end with a bang, quite literally. The chemists mixed two chemicals, a seemingly innocuous task. As they combined these substances, the room filled with the expectant air of creation. The anticipation was tangible, the excitement palpable. They were on the brink of discovering something new, something that could redefine their understanding of chemistry. But then, without warning, the unexpected happened. The chemicals reacted violently, causing a powerful explosion that echoed through the lab and beyond. The force of the blast was so intense that it shattered windows in a 5-block radius, raining shards of glass onto the streets below. The once quiet lab was now a scene of chaos and destruction. The aftermath was shocking. The scientists, who had been filled with the joy of discovery moments before, were now grappling with the raw power of their experiment gone wrong. Their faces were etched with disbelief as they surveyed the damage. The lab was in ruins, their experiment a catastrophic failure. Their dreams of discovery had been replaced with the harsh reality of destruction. But in the wake of the explosion, there was a valuable lesson to be learned. The chemists realized that their calculations had been off, that they had underestimated the power of the chemicals they were working with. They had been so focused on the potential of their experiment that they had overlooked the risks. This experiment was a harsh reminder of the unpredictable nature of science and how careful scientists must be during their explorations. It serves as a cautionary tale for all those who dare to push the boundaries of knowledge, reminding us that with great power comes great responsibility. Sometimes, an experiment gone wrong can lead to a product that brings joy to millions. Take a journey with me back to the 1930s. The world was in the throes of the Great Depression, and daily life was challenging. Amidst this backdrop, a company called Cautionary Products was on the brink of bankruptcy. They were a soap manufacturer, but they had a novel idea to pivot their business, creating a wallpaper cleaner. With coal heating being popular, soot would often stain the beautiful wallpaper designs in homes, and Cautionary aimed to solve this issue. A team of dedicated chemists was put on the task. Their mission was clear: create an effective compound that could clean wallpaper without damaging its design. After countless trials and errors, a unique substance emerged. It was non-toxic, easy to mold, and could lift dirt off surfaces without leaving a residue. They had created the perfect wallpaper cleaner, or so they thought. The substance was indeed excellent at cleaning wallpaper, but it had a significant downfall. As homes transitioned from coal to gas heating, the need for a wallpaper cleaner diminished. The product that was once seen as a potential savior for the company was now considered a failure. But, as it would turn out, this so-called failure was about to become the company's unexpected success story. While the chemists were wallowing in their disappointment, they noticed something intriguing. Children were playing with the substance as if it was modeling clay. The non-toxic and easy-to-mold characteristics of the product made it a perfect fit for a children's toy. Recognizing this, Cautionary quickly pivoted again, rebranding their wallpaper cleaner into a product we now know and love as Play-Doh. Today, Play-Doh is a beloved toy worldwide, bringing joy to millions of children and adults alike. It's hard to imagine a world without this colorful, squishy substance, and to think it all started with a failed experiment. Even in failure, there can be unexpected success. In the 1950s, the rush to eradicate polio led to a terrifying medical mishap. The polio epidemic had been wreaking havoc, causing paralysis and even death, especially among children. The race to find a cure was a matter of life and death, and the whole world was watching. In this high-stakes environment, a pharmaceutical company named Cutter Laboratories developed a vaccine. Yet, unbeknownst to them, a horrifying mistake was about to unfold. The vaccine, which was supposed to contain a killed or inactive version of the polio virus, was in fact teeming with live virulent strains of the virus. The Cutter incident, as it came to be known, was a disastrous setback in the battle against polio. As the vaccine was distributed, it didn't protect against polio, it caused it. The live virus in the vaccine triggered an outbreak. Hundreds of children were directly infected and thousands more were put at risk. The public reaction was one of sheer panic. Parents were terrified for their children's safety. the dream of a polio-free world had turned into a nightmare. The Cutter incident wasn't just a medical mishap, it was a societal catastrophe. In the aftermath, the vaccination program was immediately halted. The Cutter laboratories were investigated, and the incident led to significant changes in the way vaccines were produced and regulated. Today, vaccine production follows stringent quality checks and balances to ensure that such a disaster could never happen again. Yet, the Cutter incident left a deep scar on the public psyche. It shook people's trust in medical research and vaccines. The fear and skepticism that arose from this incident still reverberate today, as we see in debates around vaccine safety and efficacy. Remembering the Cutter incident isn't just about recalling a historical blunder. It's a reminder of the critical importance of thorough testing, quality control, and public trust in medical advances. This incident shook public confidence in vaccines, a repercussion still felt today. Sometimes an experiment gone wrong can result in tragedy. Such was the case with the Therac 25, a radiation therapy machine that, due to a disastrous software bug, gave patients radiation doses thousands of times greater than intended. This wasn't a simple case of a machine malfunctioning. The Therac 25 was a state-of-the-art device designed to treat cancer by delivering precise doses of radiation to malignant tumors. It was a beacon of hope for many patients, a testament to the astonishing progress of medical technology. But lurking beneath the surface was a fatal flaw. A software bug, a tiny error in the machine's programming, would turn the Therac 25 from a life-saving tool into a deadly weapon. The bug caused the machine to administer radiation doses that were not just slightly higher than intended, but thousands of times higher. Imagine the equivalent of receiving hundreds of years' worth of radiation in a single session. The consequences were devastating, leading to several deaths and many more injuries. The medical community was shocked. How could such a catastrophic failure have been allowed to occur? The answer lay in the lack of thorough testing and safety protocols. The Therac 25 was rushed into service without rigorous checks, a decision that had tragic consequences. The aftermath of the Therac 25 disaster was a period of deep reflection and change. The medical community realized the dire need for stringent safety protocols, especially in devices that could potentially harm or even kill patients. Medical device regulations were overhauled, with a new emphasis on rigorous testing and safety checks. The Therac 25 disaster served as a wake-up call, a harsh reminder of the potential dangers of unchecked technology. Today, the Therac 25 is remembered not just as a symbol of a terrible tragedy but as a catalyst for change. Its legacy is a safer, more cautious medical community, one that recognizes the importance of rigorous testing and safety protocols. This tragic event served as a reminder of the crucial importance of thorough testing and safety protocols in medical technology. As we see, experiments gone wrong can have profound effects, from shattered windows to unexpected toys, terrifying outbreaks, and tragic accidents. In the instance of the unexpected explosion, the unintended outcome was a stark reminder of the importance of safety measures and protocols. It underscored the fact that even the most seemingly insignificant details can have far-reaching consequences. It taught us that in science, there's no room for complacency. The unintentional discovery of Play-Doh showed us that sometimes failure can lead us to unexpected places, and even to success. This accidental invention brought joy to countless children and became a household name. It's a testament to the fact that, in science, there are truly no wasted efforts. When we look at the failed polio vaccine, we're reminded of the critical role of rigorous testing and quality control in medical research. This unfortunate incident led to stricter regulations and standards in vaccine development. It's a painful lesson in the importance of thoroughness and diligence in the face of urgency. The Therac 25 disaster, a heartbreaking event, brought to light the potential hazards of relying too heavily on technology without adequate fail-safes. It forced us to reevaluate our approach to technology and healthcare, promoting a higher level of vigilance and a more comprehensive understanding of the systems we use. In conclusion, each of these failures served as a stepping stone towards improvement. They have shaped our scientific and medical practices today, making them safer and more effective. They've taught us how to learn from our mistakes, to adapt and evolve. They've shown us that failure is not the end, but rather a new beginning. Science is a journey of discovery, and sometimes the path to understanding is paved with failures. Each mishap, each failure, is a lesson that propels us forward, making us wiser and more prepared for the challenges that lie ahead.